The latest Hilda survey is out, and this year's annual Household Income and Labour Dynamics survey paints a pretty gloomy picture. Australians are retiring later, have fewer friends, are less fertile and are reporting more physical pain. With more, here's Roger Wilkins, who's the co-director of the Hilda Survey Project. Hi there, Roger.
Hi there.
So how did you gather this information? Who did you speak to?
Well, the Hilda survey, it's a very long-running study. We started back in 2001 and we've been interviewing the same people every year since, as well as their children and in some cases their grandchildren. And we asked them about all sorts of aspects of their life in Australia to really generate this moving picture of life in Australia.
Let's look more closely at the findings then. People are retiring later. How much later and why is that?
Well, yes, so we are, as you say, retiring later than ever before. And it's mostly, I think, for good reasons, as in, we have higher life expectancy. People are retiring much less because they have to and much more because they want to. So when we in the early days of the Hilda survey, we found it was much more common for people to report that they retired because they lost their job or their health wasn't holding up. That health is still an important factor, but it's much less so now. And so people are seeming to be able to retire a lot more when they feel financially ready. Of course, the other side of that is that perhaps people are certain people feel like they have to work longer to be financially ready, particularly if you don't own a home or you're still paying off the mortgage, that could be a factor in delaying retirement. But yeah, obviously, we've had the pension age increase to 67, so that's probably, sent a signal that and a constraint for many people in terms of when they can retire. But there's a lot of factors at work, obviously.
And we have fewer friends, Roger. Is that a legacy of the pandemic?
Well, it's a longer running trend than that. So I think the pandemic possibly accelerated this trend, but we might be the internet and social media might be more implicated than the pandemic. I think in this trend, particularly for young people, we're seeing a big decline in the number of friends people report having. But it's across all age groups, it's certainly, I think, a cause for concern because having good social networks and regular in-person social contact is associated with a lot of positive well-being outcomes. So improved mental health, improved general economic and social well-being.
And you found that we're having fewer children than we want. Is that new or was that an existing issue?
No, there's always been this tendency for people to end up having fewer children than they intend to. People for various reasons don't end up having as many as they might have hoped for. You don't meet the right person, or you have difficulty getting pregnant, or life can throw different things at you that derail those plans. But I think what's really concerning is that people's intentions have been shifting quite a lot, and they've actually particularly shifted sort of in the last 4 to 5 years downwards. So we're now on average intending to have fewer children than would be the replacement rate. So we talk about 2.1 children per person being per woman being the replacement rate, and now both men and women are expressing an intention to have fewer than that. And given what we know that people's on average intentions are, certainly on average not quite met, it's going to have some significant down the track demographic implications that are probably a concern. Given we already have an ageing population, this would only sort of further exacerbate that trend.
What about the reports of more bodily or physical pain? Can you tell us about that?
Yeah, this was a rather striking finding because we've had a lot of improvements in medical technology and management of chronic conditions and pain management, pain treatment. But in fact, people are increasingly experiencing quite severe pain, or in chronic terms, at much higher rates. And this, partly can be explained by the fact that we are, as I mentioned, ageing as a society, but on average older. But it's not the full story. We see it within age groups as well, and it seems to be related to growing rates of obesity. So people who are overweight and obese tend to also experience more pain, and so that seems to be one of the important drivers of that phenomenon.